Stroke is one of Australia's biggest killers. It occurs when blood can't get to your brain because of a blocked or burst artery. And around the world, 1 in 4 people will have a stroke in their lifetime. That's approximately 1 Australian every 19 minutes.
But the good news is, by controlling risk factors like blood pressure, more than 80% of strokes can be prevented. And one of the ways we can help lower the risk is through a healthy, balanced diet.
Here to tell us more is Sunrise Nutritionist Sarah Lorenzo. Good morning to you.
Good morning.
How on earth is what we eat able to impact the risk of stroke?
What we eat has a huge impact on that risk. We know through research and studies done that people who have a poor diet will increase things like triglycerides, blood pressure, cholesterol, type 2 diabetes and obesity. So they all will increase your risk. But in contrast, a beautiful healthy diet will lower that risk. And seriously, it is the second cause of death globally and the third cause of disability. So it's something that I love that we're showing awareness of this. Yes.
Well, if we want to reduce the risk of a stroke, how do we do it? Take us through it.
Okay, the dietary guidelines are, first of all, you want to be looking at around 4 pieces of fruit a day. And when I talk to patients and people about this, make sure, don't forget things like avocado and tomatoes also count for fruit. 5 to 7 serves of vegetables, really leaning towards those wonderful, gorgeous leafy greens, lots of vitamin C, 3 serves of protein a day. I always say to people, go towards the white protein, stay away from the reds, from the saturated fats. 3 serves a day of grains, complex carbohydrates, really important for lowering cholesterol and driving down inflammation is so important. So just things like avocado. If you don't like avocado, walnuts. If you don't like them, salmon. And definitely olive oil is the best. I have a jug of olive oil on my table at home and I just encourage my kids all the time to embrace that. 2 tablespoons a day is anti-inflammatory. Nuts, seeds, very much a gorgeous Mediterranean feel is what we're really looking for.
Okay, what does a day on a plate actually look like?
Okay, so what it looks like here, just as I've done here, I've done some oats, wonderful, gorgeous for lowering cholesterol, some yogurt, strawberries, all that antioxidant support, walnuts are amazing for driving down inflammation. Now for lunch here, I've just done a whole grain wrap with some avocado. That's just bringing in the avocado, the leafy greens there, just a bit of grilled chicken and then just wrap that up. And I put a bit of hummus down there as well because hummus is a great source of fibre because of the chickpeas. So that's the end product there. And for dinner, just a bit of fish with some vegetables and then bringing in grains as well. And I always say to people, when you're looking at what portion you are for grains, because people with who want to avoid stroke, they need to maintain a healthy weight. For women, it's like your cupped handful, and for men too.
Right.
Always use your own hand because we are all different shapes and sizes.
And that, so just really quickly before we get onto the stuff that clearly can avoid a stroke, or not, I should say.
Yes.
Is that all of those requirements on a plate? So is that 4 serves of fruit, 5 to 7 serves of veggies, all there?
Yeah,
okay.
I forgot to mention, sorry, I did forget to mention this down here. So this is where you can really bring in snacking things like nuts and seeds should be part of your snacking and the fruit there. But yes, definitely. That's just bringing it all together.
What should we avoid?
Okay, so as I mentioned in the beginning, these are all
yummy
the things
stuff, right?
that are going to drive up every risk factor for stroke. And this is, as you guys mentioned in the beginning...
There's beer there as well.
Yeah, I know, there's artificial sweeteners, beer, fried foods. But that 80% of preventable strokes is for people changing their diet and lifestyle and removing these kind of things. It's just really important.
I'll eat it all except the sweetener.
Yeah, the sweetener. We should avoid that.
Artificial sweeteners, 100%. I could shout that from the rooftops. It's absolutely to be avoided.
Stay away.
Yeah, it actually leads to obesity, cardiovascular disease. They are so carcinogenic. But these changes you can make, if you make these over a 3-month period, you will significantly reduce your risk of stroke and people who've had a stroke having another one.
So do this for a 3-month period and then you can have a donut.
No, it's a way of life.
Oh, okay.
It's a way of life, Shirvo.
Okay. Thanks for the
Sarah.
good news.
Okay, thank you.
You can find all the recipes on the Sunrise website, of course.